By the time Emily Seberg of Birmingham, Michigan was 15 years old, her right leg was nearly 4 inches shorter than her left, and the discrepancy was getting bigger and bigger every year.
I've been teased basically my whole life about it. All the other kids could just run around and play, and I limped around.
Emily was born with congenital fibular hemimelia, where a part or all of the fibula bone, one of the 2 bones in the calf, is missing. And the other bone, the tibia, is usually smaller in size and length. In addition, her right foot only had 4 toes and was turned backwards.
So she had surgery at 6 months old to correct that, or she would not be able to walk. Over the years, her left leg continued to grow normally, and her right leg did not.
Early on, we did a lift on her right shoe. It was a large lift. As she got a little older and we continued with the lift, 6 years of age, 7 years of age, the kids notice it more and they might comment on it, and that started kind of bothering her in terms of hearing a comment and the feeling that I'm different and I'm not the same as the other kids.
Despite her limitations, Emily developed a passion for softball. But as the difference in the length of her legs increased and it became nearly impossible for her to run, she began relying on teammates to run the bases for her. That's when Emily and her parents decided it was time for limb lengthening surgery. They'd been researching surgical options for years, but they never came across an option they felt was right for Emily.
One of the hospitals that we went to, they suggested amputation, and that was just so barbaric and out of the question.
The other option was to cut the leg bone and insert pins into the bone that would be joined to a circular fixator on the outside of the leg. The limb is lengthened by turning the screws in the leg a little bit at a time each day for a number of months. Pediatric orthopedic surgeon Dr. Ahmed Bazi says that while it's a viable option for some patients, there are problems that can arise.
This hardware, even though placed sterilely, is sticking outside the skin. And given that, you can have pin tract infections. Also, the pins can tether certain muscles or tendons. And the biggest thing is the stigma of a child having something like this and how they were perceived and how they perceived it on their body. When I first met Emily, she came actually seeking new innovative technology to lengthen her limb.
Dr. Bazi offered Emily a groundbreaking internal limb lengthening procedure called precise nail. During the surgery, the leg bone is cut and a telescopic titanium rod is inserted.
The issues with pin tract infection, scarring, as well as self-perception issues have really come a long way and have been corrected with an internal implant.
He mentioned this new procedure, and we were just so happy and so excited. It was exactly what we've been waiting for.
Emily was the first pediatric magnet-driven internal limb lengthening patient in Metro Detroit.
I was introduced to internal limb lengthening by Dr. John Herzenberg, who really was one of the co-developers of this product. I knew this would be truly a game changer.
Dr. Bazi jumped right in, didn't miss a beat, and there was that, I think, instant synergy between all of us, and I think that made a big difference.
Following the surgery, Emily used a remote control magnetic device to lengthen her leg. The nail implanted in the leg contains a rare earth magnet that engages with the magnets in the device, lengthening the bone about 1 millimeter each day.
I expected it to hurt or feel different than it did, because it didn't really feel like much.
As her bone lengthened and healed, Emily wore a protective boot on her leg. After about 7 months of using the magnetic device and lengthening her tibia by nearly 3 inches, Emily visited Dr. Bazi for a follow-up appointment.
So, we got you where we want you. How would you feel if we got rid of that boot?
I don't wear the boot anymore?
No more boot.
Wow.
We're good. You're pretty solid. Okay? Cool.
That's incredible. I'm gonna go buy some shoes.
After a few more months to allow the new bone to solidify, Dr. Bazi will remove the rod from her leg. Shortly after, Emily will be back on the softball field.
She has no more limitations. It's such a wonderful feeling and so great to see her being a typical 15-year-old.
I can run without having to limp, and I can also ride my bike.
Emily has responded well, as she has always been in good spirits. She has a balanced gait now, and that's what's so rewarding for Emily as well as for myself to be doing cases like this.
Children's Hospital is very consistent in the way they have treated us as a family and Emily as a patient. Very inclusive, very caring and very loving, and really concerned about doing the right thing.
People used to see me as the girl who had one shorter leg, and now they don't see me as that anymore, and it makes me feel great.